The missing link, which I believe is a biographically focused multi-network algorithm that we have to create, starting with the 5 of us, to significantly heal and improve functional disorders. So as I said, everything started in the 1900 before Christ. Women start having this behavioral abnormality because they couldn't bear children and they couldn't marry. Imagine their life's mission, what a woman is meant to do biologically. A lot of us choose socially not to have children, but biologically, the women's body is designed to have children. So they start behaving really strange. And the Egyptians is like, I'm going to make up a word and I'm going to call it hysteria. And they said, okay. So what happened is in 1896, Sigmund Freud comes and is like, wow, a lot of these women, they actually had childhood trauma. And what I believe is happening is that there are unconscious conflicts that are converting into a neurological symptom. So he called it a conversion disorder. Then in 1968, they said, well, truly, a lot of these conditions have psychological factors and stressors. Then, in the 70s, they said definitely psychological factors, and these are causing conversion, hypochondriasis, and somatization. Later on in the 90s, they said yes, and it's giving a lot of different symptoms. Motor symptoms can be weakness, dystonia, sensory symptoms, numbness, burning, patchy, stinging, seizures, what Megan and Judy work with, and mixed, all of them, and others that I haven't mentioned. And then what started to happen in actually in 2013, they give the name functional neurological disorders. They say, yes, this is a problem functioning. It comes from the brain. And in the 2000s, there are so many MRIs, so much scientific evidence that shows the areas of the brain in functional and structural MRIs that had the problem. So in 2013, they said, no, the neurologists and the neuroscientists have to solve this problem. So in 2013, the neurologist said, okay, well, what we know is that childhood trauma, unconscious conflicts, emotional conflicts, stress, psychological factors are turned into neurological symptoms. Multiple subtypes, multiple symptoms is showing in the brain. And this is not only giving neurological disorders. This is giving IBS. This is affecting the gut. This is giving fibromyalgia, fatigue. This is giving memory loss. This is giving pelvic pain. This is giving endometriosis. This is affecting each single functioning of the body because, guess what? The brain is involved in the functioning of the entire body. So can I have this? Can I have that? Can I have this? Yes, you can have anything because your nervous system is involved in everything that we do. From breathing to seeing, to having a strength, to controlling your movement. So look at all the various names that we have for all the various symptoms. Look at all the specialties. And guess what? They are now saying that migraine is an inherited functional brain disorder. So before we said, no, functional neurological disorder is the second most common neurological disease. The first one is headache. Now what? The first one is functional neurological disorder because now, listen, we're dealing with the most common neurological disorder. And they are still saying this year, 2022, last year, 2021, psychological comorbidities, medical comorbidities. If your physical body gets sick, your whole nervous system is in alert. The emotions get involved, the environment gets affected, your interpersonal relationships. So of course, it can get unleashed from a physical condition. There are psychological features and there are physical features. So before they said, this is the same prevalence as MS. No, now is the commonest condition in neurology, and you can see it in all the specialty. But you know what they said? It's increasing in children too. Watch out. If we don't get onto this right away, it's going to become, if it is not already, the commonest disease affecting our children, our nephews, our nieces, this is serious stuff. And everyone tells me, why are you so impatient? And I'm like, why not? Why not? So this is what they were saying before the previous Functional Neurological Disorder Society conference. Who gets this? Anyone really. And I'm going to ask you to please rethink the definition of trauma, stress, challenge, adversity, because anything that puts your nervous system in alert, anything that throws off your emotions a little bit, that's another possibility to throw your entire nervous system, mind, body connections off balance. So, emotional disorders, personality, physical, stressors, trauma, childhood, panic attacks, sleep paralysis, anything really, anything can give you functional neurological disorders. Risk factors, childhood abuse, neuroticism, I don't even know the meaning of that word, is so old. Irritable bowel syndrome, chronic pain, emotional disorders. So really, mind, emotions, physical body, environmental triggers. We're talking about the entire human experience. It can enter through any of our field. So this is also all the stuff. Yeah, everyone is going more to the emergency room. They are getting admitted. $256 billion in the United States per year. Yeah, this is all the stuff. What is the newest stuff? Well, it's still happening mainly in women. It's starting every time in younger and younger women and even children. It's affecting our task force, people in the working and there is an iPhone. People who are in the reproductive years, working population. They are saying that in functional seizures, the mortality is higher. In some studies that in seizures that are from a structural lesion in the brain, seizures that happen because of a tumor, because of a genetic disorder, because of a stroke, those patients are doing better. They're dying less. Can you believe it? That people who are having functional seizures, and some of them, this is so sad, some of them are killing themselves and poisoning. It's also affecting more our youth. It's also causing more expenditure in hospitals, in the healthcare system. But wait, since 2013, neurologists, we promise we're gonna pay attention to mind-body and avoid mind-body dualism. We're gonna pay attention to the psychological factors, even when they are not apparent at the time of the diagnosis. We're gonna take it into consideration. Because in medicine, true success is achieved when we can prevent a disease. We're also going to try to prevent it. So since 2013, what have we been doing, neurologists? Cognitive behavioral therapy and physical therapy. These are the two main therapies. And in the 40s until 2013, the prognosis was pretty bad. Only 20% remitted completely. 40% did the same of worse. In some studies, 66 to 100% did the same of worse. 44 to 99% same of worse. Less than 30 to 40% remission. It was pretty bad. So what's happening since 2017, the last Functional Neurological Disorder Society meeting, when multidisciplinary approach is taking place? That is being the game changer now. So what is multidisciplinary approach triggering? Well, In this study, for example, 87% of patients had significant symptom improvement, but this is what sadly happens a lot. Then the improvement declines as time goes by. And a lot of patients are developing other functional symptoms or they have recurrence. So at the 6-month follow-up, it went down, the improvement, to 69.2%. And a study done in the pediatric population in 2021 had 1 month, again, multidisciplinary care. This is the best we have now. At 1 month, 70% had improved. At 3 months, it went down. No, a little bit more. 75% had improved. But at 1 year, then it went down almost by half. More than half, 32% had complete remission. So improvement, and only 32% got really cured. The REACT was another trial, study multidisciplinary approaches, and 57% were seizure-free at 1 year. Then yes, that is an improvement with the past century, but still, we're talking about a dysfunction of the brain. There is no structural damage in the majority of cases. Can we do better? Are we missing something? So I put together this diagram summarizing. Outside in the outermost part is all the risk factors and all the causes that have been described in the literature. Prenatal, childhood stress, even the hypothalamic pituitary axis that starts to form in the uterus can start to show dysfunction and acquire malfunctioning because of stressors, attachment theories. Then there is everything that is affecting the neocortex, our cognitive brain, the way we perceive the world, our thinking, our planning. We can learn it, we can be conditioned, we can give ourselves self-suggestions. Then stress and trauma, and I said, can be mental, emotional, physical, social trauma. There are many society perpetuating factors, you name it. All of that, and any of that can affect the neocortex. Again, our perception of the disease, our perception of the world, our awareness, our interpretation of the symptoms, our cognitive regulation, our self-control, our agency, the social cognition, the neocortex. Any of the factors that I said that can affect us can affect the limbic system, the center of emotions. But look how many little and specific processes in the emotional system can be affected. The emotional awareness, being aware that you're having an emotion, the emotional appraisal, what you make out of that emotion, how you interpret that emotion, the emotional retrieval, being able to retrieve an emotion that you felt in the past. Self-reflection, what you determine to do, how you relate in front of that emotion that is taking place, how you process the emotion, how you regulate it so you don't kill someone when they cut you off in traffic, how you keep driving, how you regulate your emotion, how you integrate your emotion into your wisdom. Because if someone mistreats you, you learn, I don't want to be with that kind of person. So integration into your wisdom. The suggestion, how can you suggest yourself to have certain emotions? Suggestion in yourself. The defense mechanisms associated with emotions and the connection between the physical body and our emotions. I want that ice cream, I'm gonna run. I wanna ask a question at the conference, I'm gonna walk faster. That's emotion connected to the motor system. I am feeling sad. I just want to be in bed and you don't move. Look at everything I said about emotions. Don't forget that. In the autonomic nervous system, the autonomic nervous system gets activated. Sometimes the heart rate goes up, the breathing gets shallow and really fast. There is excessive hypothalamic pituitary adrenal axis activity. So adrenaline is up, hypervigilance, the muscles are tense, the mouth is dry, you cannot swallow, the voice gets hoarse. Autonomic arousal, startle responses, muscle jerks, and the stress responses, they are all over the place. Freeze response, the patients freeze, the patients get on fight or flight. All this is happening. And the somatic, the soma, the body, the sensory motor connections, they are also abnormal. And they are hyper coupled. They are very, very tightly connected to the emotion system, the limbic system. The body gets automatically activated. That's responses that are mediated by the subconscious mind, because the body is connected to the autonomic nervous system and the emotions. That's in the subconscious mind. Look at the neocortex upstairs. And so your body is connected to the autonomic system and the limbic system. So autonomic, automatic activation, automatic inhibition, weakness, falls, paralysis, seizures. Subconsciously, the mind is up there, and the mind, the cognitive brain is like, what's happening down there? Look at all that stuff. So, excessive evidence. And now I'm going to tell you what they are doing. And Megan and Judy, this is where you're going to tell me that I'm wrong. If I am wrong, this is what I gather that they are doing in the multidisciplinary clinic. They are doing all that physical, occupational, and speech therapy, neurophysiological regulation, habit reversal, cognitive, behavioral, emotional regulation. The family gets involved, the social system. Emotional regulation. How many things did I tell you that were affected in emotions? I told you at least 10. Look at the limbic system. Look how many processes, 10. Emotional regulation is just 1. You're leaving other 9. Autonomic nervous system? Are you, how? Are you guys doing it? How? This is another study. You're doing all this, and this is wonderful. This is great. But I don't see the word emotion or autonomic here. And none of these involve, none of these therapies, which I know what they do, all of them, none of these deeply go into the limbic system. None of these deeply go into the autonomic nervous system. And this is another one on the right, which great. It has the emotion recognition log, and great. That is another aspect of emotion. You're leaving still 8 behind, and the autonomic nervous system is not well represented within your therapies. One thing of the multidisciplinary therapies that I want to get Ashley's opinion and Derek's opinion too, and maybe Judy, you tell me your opinion about your family. What do you gather? Would it be better to have one doctor that knows how to treat all the networks? Or do you want to see 10 doctors? You want to see 5 doctors? You want to deal with 5 doctors' personalities? Do you, yeah? With 5 different therapies? Or would you like to see one doctor that knows how to do it all? Think about it. I don't know. Okay, so what I believe, Megan, is happening truly, and I tried to ask this in the conference in many different ways, is are we really equivalent addressing all the networks? I believe there are important pieces left behind. So what I am suggesting, I just got a little, let's see. Okay, so look, I study all of them, each process, and each process can be targeted. And in the neocortex, and in the limbic system, each process can be targeted. It is not that hard to do it. We just have to develop an algorithm. I'm working on it. I need partners. I am calling to you all. And there are techniques to target them all. There are. Because everything that the brain does, we feel it, we do it, we sense it. We are connected to the brain through our stomach, through our heart, through our breath, through our sensation, through our memory, through our attention. We can create an algorithm and target them all. So that was the presentation summarized in 10 minutes. So I think we can put a model of experiential education in the support groups where I am going, me and everyone who can join me. I want us to, all of us, to try this. Teach patients how all these little parts of the brain work and feel it. Let's feel. I was acting it out here for you all, and you felt some things in your body. We can practice together. We can do it together. It's a lot of fun. It's educational, and it can be healing. I want to do this in individual sessions too, biographically, because this is where it gets a little bit complicated. When you start going into the childhood trauma and the past, that needs a little bit complicated. It's not so simple as in the educational work. No, you have to cry with the patient. You have to feel it with the patient. You have to regulate it with the patient. You have to jump with the patient. You have to shake that seizure that is lodged in your autonomic nervous system. You have to do it with the patient. And when the patient has the dissociation in the office, you go with the patient and you explore the dissociation. And when the person is shaking uncontrollably, you go into the memory, you go into the emotion, and you do it with the patient without getting scared. This is what we have to. So we have to go to the trauma. There is no working in the present moment. And I have other many lectures that talk about implicit memory, that talk about the connections of implicit memory, which is buried in the subconscious, the connections with the nerves and the muscles, and it's unbelievable. So, and of course, I want to study ayahuasca, but that's going to be in the future in Brazil. So I'm going to stop share. And I want to hear your opinions. And I want to hear and I'm sorry, that was more than 10 minutes. I'm sorry.